Hello again. So let's talk about ways to cope in labor. This is definitely a big one for people as they get ready to have their baby. It doesn't matter if it's your first baby or your fifth because every labor and birth experience is a little bit different. So let's dive in and talk about the tools that you have to use as you have your baby. Non-pharmacological pain relief refers to comfort measures and pain relieving techniques that do not require drugs or anesthetics. So, comfort measures that provide natural pain relief can be very effective. Techniques such as hydrotherapy in a bath or shower, rhythmic breathing, movement, massage, and counterpressure and visualization exercises can increase the production of endorphins and help relieve pain sensations experienced during labor. A couple of my favorites are movement, music, hydrotherapy, and counterpressure. Movement is great in labor as it allows the birthing person to adjust to the needs of their body and the descent of their baby. Walking, squatting, using a birth ball and swaying your hips, lunges, slow dancing with your partner, etc. The best position in labor is changing positions. When you are in active labor, your contractions come in a pattern, and then when you move in a pattern that goes with the contractions, you're often better able to work with how your body is in labor and the contractions that your body is falling into. Think of like swimming in an ocean. When you get in the pattern of the waves, you can anticipate them, you can ride them, you can float with them, you can use them. But then when you step outside of that pattern and one hits you in the face out of nowhere, it feels very different. And that's kind of the difference between getting into the pattern of your contractions and being out of sync with them. Pattern and rhythm then leads me to music. I think this is one of the best labor support tools, and it's totally underutilized. You can play whatever music you wish. Pack a small Bluetooth speaker with your birth supplies. It will give you a rhythm to work with as you move and something to focus on. I've had people labor to hypnobirthing or meditative music. I've had people labor to prayers and religious songs. And one time I had someone labor through the entire Beyonce discography. Make a playlist that makes you feel good and relaxed or powerful and strong. The one thing that I ask is that you don't play one song continuously on repeat if you want your midwife to ever be able to listen to it again. But honestly, if that one song is what you need, we can deal with it for a labor. Hydrotherapy is using water for pain relief. This is amazing for a couple of reasons. If you have a shower, you can use the shower head to create rhythmic strokes of water across your belly or pinpoint areas on your back that are bugging you. If you have a bathtub or we are laboring at Trillium Mississauga Hospital, you can have a bath. There is a pool there for us to use. Submersion up to your nipple line causes your body to release hormones that help relieve your labor pain. You get buoyancy that allows you to move your hips a little bit easier as you labor your baby down. Also, submersion in water creates a kind of personal space bubble that people have to physically enter to touch you. In labor, your midwife is listening to your baby every 15 minutes and your partner is trying to help you and maybe not sure how to meet your needs. Sometimes giving you a personal space bubble can allow you to focus mentally and physically on the job that you are doing for a while. So, counterpressure or a hip squeeze can feel really great in labor. This is something that I love to teach partners or support people to do. What you do is you actually landmark along the dimples just above the sacrum. So, those like little dimples that everybody has in their back just above their bum. And then if we have a little pelvis here, I'm going to show you on this pelvis. So, what you actually do is you wrap your hands kind of around the hip bones with the heels of your hands along where those dimples are, which is right about there. And you kind of press forward and squeeze open. So you can see how I'm changing the diameter of the hip and providing a bit of counter pressure there. And it feels really, really good. Practice with your partner before labor to figure out what feels good for them. The key here is that you need to hold steady for the entire contraction. Oftentimes I find that partners want to rub, like in a massage, but really just squeeze and hold. Okay? You can sway with the birthing person if they are swaying in a rhythm, but don't rub and create your own rhythm or you will distract them and throw them off. So practice holding this for 1 minute steady. You can also provide counter pressure with the heel of one hand just above their sacrum. So the sacrum's right here, just like this. If you're using one hand for something else, or if they're lying down and you can't wrap your hands around both hips. So you wouldn't have your hand here, I'm just holding this up. You just provide pressure like that. Nice and steady, and that can really help with back pain in labor. Same rule for pressure and duration applies. All right, just to show you how easy doing a hip squeeze is, I am going to show you on my wonderful voluntold husband, Thomas. Wave to the people, Thomas. We're going to pretend that Thomas is having a baby. All right, Thomas, you're in labor. So, what you do, you find the hip bones right here, okay, right there. You place the palm of your hands along the hip bones, and then you squeeze and hold. And you don't move. And I'm putting a lot of pressure. And does that feel nice, Thomas?
Lovely.
For your labor pains?
It's fantastic.
And you squeeze and hold. All right, from the side. Landmark. Right there. And you can see my hands kind of wrap around the hips right there. And then you squeeze and hold. And I'm putting most of the pressure into the heels of my hands, but using my fingers just to gently open up the hips. Okay, good laboring. TENS machines are another great non-invasive therapy that you can use to help relieve pain in labor. So what it is, it's a battery-powered unit or a plug-in unit which sends electrical impulses through electrodes placed on your back. It's great if you're having back labor, for example. So the electrical current stimulates the body's production of endorphins and blocks pain messages at the spinal cord. This is called the gate control theory of pain relief, if you want to look it up and do some more research on that. You cannot use this at the same time as you're using hydrotherapy for obvious reasons. We don't stock these at the clinic, so if you are interested, you can purchase one or borrow one from a relative. A classic non-pharmacological pain relief technique that your midwife can use for you, especially if you're having back labor, is something called a sterile water injection. So it's really safe and really simple. What your midwife does is we inject a small amount of sterile water in 4 points just under your skin on your back. It intensely stings for about 30 seconds. It feels kind of like a bee sting following each injection. So we work really quickly to make this as comfortable as possible for you, but then back pain is frequently relieved within 2 minutes and the effect can last for 45 minutes to 2 hours. It works similarly to the TENS machine with the gate control theory of pain relief, and this technique can be repeated after an hour for further relief if you like it. Something to note for non-pharmacological pain relief in labor is that sensations and needs change as labor progresses. Something that was working really well at one point may not feel so great at other parts in labor. Partners and support people, don't be offended if you are told quite crossly that something is no longer working. Labor takes a lot of concentration. Just take the note and move on. My other important note for labor support: don't talk during a contraction. Don't throw off the rhythm. I promise your newfound dad jokes can wait until the contraction is done, and your audience will be a lot more willing to hear them in between the contractions. Something that's not pain relief exactly, but can make a big difference to your experience, is atmosphere and food. Obviously, if you have a home birth, you have the most control over these things. However, you can make a hospital room homey as well. I've had people bring flameless candles, their own blankets or pillows, some pictures of their loved ones, etc. Likewise, bring food that you like and that gives you energy. My favorite so far was when a client brought a cooler full of freezies to their hospital birth. Refreshing and sugary, great for pushing. Think about high protein food for after delivery as well. Okay, part two, which is the drugs that we have access to. So I'm going to start with nitrous oxide or laughing gas. So what nitrous oxide is it's a mixture of 50% nitrous oxide and 50% oxygen. We have this for home births and sometimes in the hospital depending on availability. You can use this during labor, or sometimes people will ask for it if they require any stitches after they've had their baby. How this works is you hold the mask tight to your face to create a seal, and then you breathe normally in and out of the mask during a contraction. It's important to exhale into the mask so that you prevent your healthcare provider from getting secondhand exposure. The birthing person is the only one who can hold the mask, and this is because if you feel dizzy, you will take the mask away from your face. Someone holding on the mask to your face can overdo it by not knowing when to take the mask away. So the effects should be felt within a few breaths, usually within 25 to 35 seconds. It takes approximately 60 seconds for the effect to wear off after you stop breathing in the gas. The gas has a sweet smell and taste. An added benefit is that it focuses your attention on your pattern of breathing and provides a form of distraction and rhythm. While the gas does not cross the placenta, there are no known risks to the baby. So nitrous oxide gas, it doesn't exactly take the pain away, but it kind of brings you above the pain and just helps you cope with it a little bit better. You might hear of people using narcotics like morphine or fentanyl in their labor. I would say they're not something that we often use in our community, but there are certain clinical situations where they might be beneficial. Say, for example, they can offer sedation or therapeutic rest for people who experience exceptionally long early labor or irregular uterine contraction patterns of early labor that lead to exhaustion. Like, rarely, but sometimes this can happen with cervical ripening during an induction. And they certainly can be used to help those people. Narcotics can reduce the fetal heart rate and impair early breast or chest feeding, and if given too close to birth, they can sedate the baby and suppress the newborn's respiratory efforts. So if they are something that's being talked about as a tool for you to use, then your care provider is paying attention to the timing of how your labor is going. Side effects and experiences may include sedation, nausea and vomiting, itchiness, amnesia, and in high doses, respiratory depression. If narcotics are required in your labor, your midwife will consult with an obstetrician to get them for you. All right, and last but certainly not least, let's talk about epidurals. So what an epidural is it is a bupivacaine and fentanyl regional anesthesia. So epidural anesthesia involves the injection of drugs through a catheter placed into the space outside of your spine called the epidural space. Hence the name. Epidurals are done for you by an anesthetist. So you need to be in a hospital to have one because that's where the anesthetists work. Epidurals are associated with an increased length of labor, but there is no significant difference in the incidence of cesarean births, parental satisfaction with pain relief, long-term backache, or APGAR scores between those who had epidurals and those who did not. So what are some reasons why you might get an epidural in labor? Number one, because you know you want one. Cool. We will work on getting you one. You need to be in active labor, so about 5 centimeters dilated with good contractions. This is because if you are in early labor, we can scare away those contractions with the epidural, and then you're admitted to the hospital, numb from the waist down, without contractions, and we've kind of created a situation where we have to then create them for you synthetically with oxytocin. It's a slippery slope of interventions that can complicate your birthing process. On the other side, if you are physically pushing out a baby when you ask for an epidural, then by the time you get your epidural, you'll probably already have a baby in your arms. So in that situation, best to focus on having your baby, and the good thing is that it will be done quickly. Your midwife will work with you to provide other methods of support and coping if it's not the right time for you to have an epidural in your birthing process. And then reason number 2, something happens along your labor story that points in the direction of an epidural being a good idea to help your labor progress. So for some people, they reach their limit of pain tolerance in labor. And if you are experiencing excessive pain or anxiety, you actually release hormones called catecholamines that inhibit your uterus's ability to provide effective and strong contractions. This slows down your labor, which leads to increased pain and anxiety, which leads to a slower labor. So pain relief with an epidural at this point can actually help your uterus do its job and progress your labor. Epidurals might also be helpful with exhaustion. So if you are exhausted and your uterus isn't able to continue giving you good, strong contractions, then sometimes a little therapeutic rest is actually what you need to allow your uterus to do its job and have your vaginal birth. Your midwife will be there to talk to you prenatally as well as during labor about any questions you have about pain relief and what your options are at different points in your story. Now, what happens with an epidural? How do you actually get one? I'm going to walk you through the process. So you've decided you want an epidural. What happens is your midwife needs to draw your blood and send it to the lab. And they also need to give you an IV and a bolus of fluid. Once the blood work is back and reviewed and your IV is running, we get the equipment ready and we call the anesthetist. Once they are available to come into the room, the procedure starts. Your midwife will wear a cap and mask as the procedure needs to be sterile. You will sit on the bed and lean forward, keeping your back as long as possible. Your midwife will be there the entire time. The anesthetist freezes your back with a local anesthetic and then inserts the epidural catheter into the epidural space. The epidural needle does not stay in your back. The catheter is similar to the one that is in your hand for the IV. It's flexible and you can lay back on it. After the procedure, your midwife will help you lay back on the bed. They will take your blood pressure 1,000,000 times in the first half hour and listen to your baby just as frequently. This is because epidurals can lower your blood pressure and your placenta does not mediate this for your baby. And if your blood pressure goes down, sometimes your baby's heart rate can go down too. Your midwife will ask you to turn onto your side and increase your IV fluid if this happens. Usually this dip in blood pressure and heart rate is temporary and has no long-lasting effects for either of you. As the point of the epidural is basically to numb you from the waist down, you can't get out of the bed to go to the bathroom. So you will require a urinary catheter every few hours to keep your bladder empty. This is an in and out catheter, it doesn't stay inside, and it will not hurt as you will be numb. We use sterile techniques to reduce the chance of UTIs. Some side effects that you might experience are an incomplete block where you have a patch that isn't frozen very well. If this is not bearable, we can reconsult with the anesthetist to see if they can come in and readjust the catheter or reinsert it and fix it. Sometimes people feel itchy all over or have a bit of a fever after they get an epidural. Rarely, if some cerebral spinal fluid leaks out during the procedure, you can get a really bad headache called a spinal headache. Nerve damage is super rare. Sometimes after people have an epidural, they experience back pain, and this is actually usually from your bones and ligaments and muscles shifting while you're having your baby, and not because of the epidural. Lying in bed for many hours also does not help with back pain. Pushing with an epidural can be quite difficult for some people, as because of the numbness, you don't get the physiologic urge to bear down. It feels kind of like you're pushing into a void, and it can be tricky to learn how to do this effectively. Because of this, if this is your first baby, having an epidural can increase your chance of needing a vacuum or forceps during your delivery. Your midwife will help you to learn how to push and keep you up to date on what's working well. The nice thing about having an epidural is that as long as you are well and your baby is happy, we can actually wait an hour after you are fully dilated to let your uterus bring your baby as low as possible before you start pushing. After your birth, your midwife will turn off your epidural. Usually a couple hours later, you have enough feeling in your legs to shuffle to the bathroom. If you are planning early discharge, as long as you are able to walk and pee, we can still send you home. Epidurals are considered safe for both you and your baby. Although, like any other medication, there are pluses and minuses. Epidurals can be a very important tool to use in some situations. Your midwife will be happy to talk with you during your pregnancy and labor about any questions you have. As far as breast and chest feeding goes, opioids like fentanyl, which is in an epidural, will reach human milk. However, it is considered safe to chest and breastfeed after receiving an epidural. Okay, so that's my talk on some really common ways to help yourself cope with labor. I've included a bunch of links below in the description about different labor positions, food and drink and labor, videos on an epidural, as well as nitrous oxide use. So have a look through, think about the tools that you have at your disposal, and you'll do great.